Hey, my name's Amanda, and I'm going to be doing a clinical bedside evaluation today on my patient Michael. How are you today?
Good.
Good. All right, so there's two parts to this. We're going to have our oral mechanism exam, in which we'll be looking at different structures in your mouth and just their basic functions.
Okay.
And then we have our food trials, and you'll just be trying different types of food with different consistencies and just make sure that you have a safe swallow.
Okay.
So let's get started with our oral mech exam first.
All right.
Basically, I just need you to sit up straight,
Mhm.
nice and tall.
All right.
All right, and then I just want you to hold your breath for about 6 seconds. All right, perfect. Now I'm going to have my tongue depressor here, my pen light. I'm going to take a look inside your mouth. I'm just going to be looking at some different structures in here and kind of stick your tongue out like, yeah. All right, I see your upper teeth and your lower teeth, lateral sulci. See your hard palate, your soft palate. It's looking good in there. All right, now I'm going to look at your jaw movement. So basically, I just want you to open and close your jaw like, good job. Now we're going to look at the lateral movement of your jaw. So just move it side to side. Perfect. Okay. And now I'm going to test your jaw resistance. So I'm going to have you open your mouth while I place my hand underneath your jaw and just try to push against it. Okay, good. And now I'm going to do the same thing, but I'm going to hold your jaw open, and I just want you to try to close it. So open up. All right, good. Now we're going to be looking at, I want you to just protrude your jaw forward like you have an underbite. Perfect. It's kind of a funny one. All right, now I want you to pucker up your lips like you're giving a kiss, and then retract them back to a smile. Awesome. All right, I want you to seal your lips and puff them up with air. Good. All right, now I'm going to use my tongue depressor again. I'm going to kind of check your lip seal. So I'm going to put this in between your lips, but not in between your teeth. I'm going to pull on it, and I want you to keep it in between your lips if you can. So close your lips tight. Perfect. And I'm going to do this side. All right, in the middle. Good. Very strong. Okay. That's all for the lips. Now we're going to look at your tongue movement. So I just want you to stick your tongue out. Perfect. Now move it side to side. All right. Pull it back in. Okay, you already did that. I want you to pretend like you've got peanut butter on the top of your mouth, and I just want you to kind of scrape your tongue front to back like you're scraping it off. Good. Okay, now I'm going to place my fingers on the outside of your cheek, and I want you to push your tongue through like you're touching my fingers. Okay, and the other side. All right. What's next? Now we're going to look at your rhythm and rate by saying some different sounds.
All right.
So I want you to just say pa 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 for as long and smoothly as you can. All right, perfect. Now we're going to do the same thing but with ta 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 ta, so just as long as quickly as you can. All right, good. And now we're going to do the same but with ka, so ka 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 ka. All right, and now we're going to do that, but we're going to put all three of those sounds together. This one's kind of hard to say, so just padaka, 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 padaka.
All right. Padaka, 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 padaka.
All right, good. And now I'm going to need my tongue depressor again. I'm going to look and see how your soft palate is functioning. I'm basically just going to look in there and make sure it raises up. So I just want you to say ah, ah, ah 3 times.
Ah, ah, ah.
All right, good. And now the fun part, I need to check your gag reflex.
All right.
So I just want you to open up your mouth, and I'm basically just going to move this slowly back on your tongue until it elicits it, and
Okay.
it's not as bad as it sounds, I promise. So open up real wide. Okay. There was no gag reflex. That's okay. Some people don't have one.
Okay.
All right. Now we're gonna check your oral sensitivity. I'm gonna touch a certain side of your cheek or of your tongue, and I'm actually gonna ask you to close your eyes on this one. Whichever side I touch, I just want you to raise that hand.
Okay.
Okay. All right. Good. And now I'm going to look at how your larynx is functioning. So I'm just going to have you do some more sounds. I want you to say ah for me. Okay, good. And now take a deep breath and then say ah for as long as you can. All right, good, good. Now we'll do some pitch changes. So I want you to kind of raise your pitch higher during the middle of the ah, so it's going to sound like ah. Awesome. Good job. Okay, now I just want you to cough for me, like perfect, and then clear your throat. Give a good awesome. Okay, and lastly, I just need to check your dry swallow. So I'm going to put my fingers on your neck, and I just want you to swallow normally, and I'm just going to make sure everything feels okay. All right, good. Thank you for helping me out today. We'll be back for the food trials very shortly.
Alrighty.